Yep.
Okay, yep, she is. Okay, so we'll call to order at 7 p.m. Is there anybody here from the public? I do not see anyone. Is there anybody here for public participation or anything?
Nope.
Seeing none.
All right, so we're opening at 7 p.m. for public participation. There's no one here. So we will close public participation. And we will now start the meeting. We need the approval of the minutes from the April 21st meeting.
Madam Chair, I'll make a motion to approve the minutes from the April 21st meeting with no changes.
I'll second that.
Okay, all in favor? Roll call. That's
Gorville, aye.
right.
Linehan, aye.
And Silver eye. So forward, the minutes are accepted. Tonight's agenda is the health director's report.
So I started to write a report, but everything kept changing every day. So I gave up. And I said, I'll give a report as of Tuesday. So I sent you the spreadsheet,
Right.
I think 2 days ago. So you can see that our numbers are pretty negligible at this point, which is great. Stacy will be winding down and Elaine will be winding down, once it's pretty much is at a point that the public health nurse can do it herself, but we're gonna be phasing that out. So we did 2 youth clinics. We didn't do them, but we hosted 2 youth clinics today in Wakefield in partnership with called Crosby's Pharmacy in Ipswich. So we did it at the Voc this morning and immunized 119 kids. Remember, they're only 9 to 12.
Right.
And then left there, went to the field house where we got more middle schoolers, 237. And he's gonna be sending me a breakdown by age so that, there was no school today, but in 3 weeks there will be school. So we may end up doing the second clinic, like partly at the middle school and partly at the high school, so that parents don't have to come and pick up their kids in middle school and bring them over to the field house. So so it's about 350. Is that right? Yeah. 350 students today, which is excellent. And the Voc was just super appreciative, the parents from all the different communities, that it was done during the school day and, they didn't have to find time to bring their kids somewhere. So, but the 16 and 17-year-olds are pretty well vaccinated at this point. So it's really 12 to 15-year-olds.
Mhm.
So, so that was very positive. We're done with all of our home visits. Oops. Hello, sorry. We're done with all of our home visits. So we're done giving vaccinations, and we're just working with the pharmacy to offer it at the schools to help out. So, so the COVID news obviously is the change in the guidelines. I got an email late today, which I haven't read. Yesterday, DESE said that they would be coming out with their prom and graduation guidelines soon. So I'm hoping that's in there because that's what everybody's asking about. But essentially, there are no more rules after May 29th with very few exceptions. So I will be curious to see if DESE has any rules, because it would just seem a little odd when nobody else has any. So anyway, so that's coming out. So basically, except for some very specific things like being on public transportation, all the rules are gone. I think For the schools, though, they'll stay with mass indoors, but they've already lifted mass outdoors without any distancing. Doesn't matter what the distance is.
Mhm.
So I've been talking to the superintendent, you know, and he sent a message out, I believe, today to the parents with some more clarification. So, so yeah, it does really actually seem like a light at the end of the tunnel.
Mm.
With this, so as you all know, the governor is lifting his state of emergency on June 15th.
Mhm.
When is the next board meeting scheduled for? Is it June 9th?
Oh,
It
it
would
should
be
be after.
the
It should be the
16th.
16th.
Okay, so you're gonna need to meet before then
Okay,
to lift the local state of emergency or local state of emergency, because you don't want Wakefield in a state of emergency when the rest of the state isn't.
did we, I thought we did. Can we just double check on the status of that? Because I remember us saying now that the governor has this in, I thought we dissolved ours. We didn't?
We dissolved the other emergency orders.
And took the,
If you remember way back, the state was very slow to react.
Right. And we
So
did the
the
mask.
board did a masking ordinance and a personal services
Okay.
emergency order and the state of emergency order. The other two you revoked, but not the
Yes.
state of emergency one.
Can we
We
do that
have-
today and just make the date coincide? No.
It's not on the agenda.
Okay, right. Okay, good point. It has come up though.
yeah. Ruth,
It changes daily.
if by the chance, quote unquote, that the new health director is not in place by then, will
So
we?
there's gonna be somebody in place.
Okay,
I can't give you the official announcement,
right,
but there will be somebody in place on June 1st.
okay.
But as a board, we can do it. It's a board's job to rescind and make orders.
Mhm.
Yeah,
I
you
don't think
You
it,
can meet whenever you want to
Yeah.
meet. I'm
I
just
don't
saying
think
you
it
can't do it.
requires the health agent to do it.
No, but normally the health director is your staff, so
Yes.
it
Yeah,
would
we
be
would
unusual
prefer
to have a
them
board of.
staff, but just to be clear, we could. The process is.
It's a moot point. There will be a person.
Okay.
And you can schedule a meeting, and perhaps tonight you want to decide what night you want to meet for the next meeting.
Okay.
Mhm.
So the other thing that will change on June 15th is the changes to the special dispensations to the open meeting law.
Right.
So
Mhm.
on June 15th, you go back to being in person. Now, there's a lot of wrangling going on right now at the governor's office and the legislature to try to put something in place so that there can still be remote part to the meeting so that the public could still participate remotely. Until that happens, unless that happens, we're back to normal on June 15th.
Or we could
So-
be together and the Zoom could be on in the room for public participation as I'm thinking what the hybrid model might look like.
Well, it won't be up to us. It'll be up to the state, and the
Right.
Attorney General's office will come out with a statement saying,
Mhm.
this is the rule and this is what you're going to do.
Okay.
So, and I would expect that to come out really quickly,
Mhm.
like in the next week or so. So, I know that when it comes out, Steve will be making sure that that gets communicated to all the boards.
Mhm. Okay. It seems that today there were a couple of things talking and a couple of articles and in the paper too, that I guess they really want to hold it off until maybe the original date in August. But I don't think so. I think most cities and towns are just going to go back. You have to go back to in person. It's time.
Mm.
It's time.
Well, you
It's
know,
time for help
it's
people.
not really what you want to do.
Yeah,
It's what the law says you have to
Mhm.
do.
right. That's true. Thank you.
So in other news, I have made an offer to a public health nurse. She's thinking about it and will give me a decision Friday morning.
Right.
But we have another candidate who, I think would also be really good. So we're in a good situation, but I do want to get that wrapped up this week. They won't be able to start June 1st, but I'm hoping that somebody can be in place June 7th so that they'll still have 3.5 weeks to work alongside of Karen. And that's what they'll do literally for 3.5 weeks is work alongside, learn about the camp stuff, mostly camp and Maven.
Yeah.
So, I was hoping to have it wrapped up the beginning of the week, but my first choice, was like, I gotta think, blah, blah, blah. So
Right.
Mm.
When is Karen's official last day? Is it the 30th?
June 30th, yep.
Okay.
So the move to 5 Common Street, oops, I lost my video, hold on.
There you go.
Okay, I'm back. The move to 5 Common Street's been delayed, where the department is still going to move there.
Wait, what? I
No.
never heard this plan.
I thought I already said that.
No.
And I need, no?
No.
Oh, sorry, back up. So the health department is moving to 5 Common Street. The original plan was for it to happen by June 1st, but the building's not handicapped accessible.
Yeah,
And they've
bad point.
decided that it needs to be handicapped accessible. So they're gonna put a ramp in probably from the parking lot.
So 5 Commons to the, so it's closer to the lake on Common?
Yes, it's a white professional building.
Yeah.
You can park out front, but
When did
but
we
you
get
can also,
that?
so basically, right now the planner is over there and emergency management, and they really want the planner back in town hall. So it actually is a win-win.
Yeah.
So
Oh, Paul gets his office. Well, it's not Paul, but
so Tom will be in our main office and Erin will be in the old planner's office.
Mhm.
And so the first floor of 5 Common, the treasurer's office is there. They have 2 offices there. And the Chamber of Commerce has an office there. And then there'll be us. So we'll have 3 large offices plus a conference room,
great.
plus, the main area too. So there's good space. There's not enough space for everybody to have their own office, but we do have some part-time people. So, if we have part-time people there on opposite days, like the public health nurse who goes to full-time and will be in Wakefield 2 days a week,
Mhm.
can work on the 2 days that Kara's not there or something like that,
Right.
so they can share an office but still a private space. So
It would be nice to equip a proper nurse's office as it is equipped in Melrose, but I guess that's for us to fight for in June.
well, you don't have to fight for anything. The space is the space.
Right. Well, good point. But it just seems to me that would be a helpful.
Well, there are 3 bathrooms on that floor. There's 4 bathrooms right now. 2 of them will be combined to make a handicap bathroom. There's a bathroom attached to one of the rooms, one of the offices. There's another bathroom in like a suite area. So, there's a lot of good space and opportunity for the nurse.
Mhm.
So, it's very positive. And what we'll do is have one person from the new grant located there, the coordinator. The grant coordinator will be located there. The communications person and the inspector will be located physically in Stoneham. So it's basically 7 people: the director, inspector, admin, public health nurse, substance abuse coordinator, mass and motion person, and the grant coordinator. So there's, as I said, it's not like everybody's going to have their private room, but it's good space.
The grant
And-
coordinator is part of the health department or part of the town?
Part of the health department. The grant,
Right,
this is for the public health excellent grant, which I'll talk about in a minute.
okay.
And the grant, it's a town of Wakefield grant for the coalition.
Okay,
So the grant coordinator will be responsible for supervising the other people who are working under the grant and the administrative parts of the grant and, all that kind of stuff.
mhm.
The reports, the mandatory meetings that the state always has.
Mhm.
Yeah. Elaine.
Love those reports, better than the meetings.
Yeah. So that'll work out well. So the grant, we've had 2 webinars on the grant this week and last week. The state has just gotten very far behind and they haven't even sent us the contracts yet. So at our meeting on Tuesday, they told us that they'd be sending the contracts out this week. Steve will sign it, we'll send it back, but the grant doesn't start until it's a fully executed contract, i.e. when they sign the grant. So we're pretty much looking at a June 1st start for the grant at this point. The good news is the 2/12 budget that we had to put in, which is $50,000, can roll, whatever's not spent can be rolled into next year's budget.
Oh, good. That's good.
So we'll basically have 350,000 for the first year. So we're working on that. We have the other health directors have all been submitting job descriptions so that they'll be ready to be posted once we're allowed, to start the grant. So we're on track to do as much as we can within the confines of what we can do. So that's all good. So the other thing legally that has nothing to do with us, but I know you're going to be interested, is the outdoor dining with liquor was also a dispensation under the Emergency Act, state of emergency. So the ABCC has been meeting to figure out, does the outdoor dining disappear on
Yeah.
June 15th? Oh, no, it wouldn't disappear June 15th. The way it was written, it disappears 60 days after the end of the state of emergency. So that would be August 15th. So the ABCC is working on all that to see whether that all ends on, or is there going to be an extension, or what are they going to do? But that only affects the places that have liquor licenses. I think that's it. Kara has started working on the Melrose Wakefield grant, the behavioral health grant 4 hours a week, starting the assessment process. So, things are good. Any questions?
Aren't you
It's
glad it's
kind of a
over?
health, it's kind of a health director's report and things that have happened since we posted the meeting, since,
Yeah.
the meeting on yesterday, I was giving you that information that I wouldn't have had to give you in a health event director's report in advance because, literally every day something else is happening. But, if everything goes according to plan,
Oh,
we're done.
wow.
Crazy.
Well-
It doesn't like feel, it feels like it should be, but in the back of, I know of my mind, and most people probably doing COVID tracing, we figured that we would be like through the summer, and I closed up like 3 cases today. And I was like, oh no, and then I just got a new one and it's like 1 case. And I'm like, am I sure I gotta go back and reread this? I'm used to 4 or 5 a day, and it's
Right.
but it's kind of nice. It's kind of a really nice feeling to know that something's been accomplished. And I did the home visit yesterday, and the people that are so thankful for everything that health departments have done. It's been amazing.
I do feel like, yeah, I think our changes happen a little faster than I would have expected.
Mm.
I guess the numbers and the science, I mean, there's
Yeah.
definitely a confluence of vaccination and weather is
Mhm.
my thought and behavior.
Yeah.
But I have, but it's really funny. I think we have to really be mindful of some unease of people who have worked so hard to stay compliant, and
Mhm.
they're like, what, like there's I think we'll roll this back in kind of a almost like a security blanket way, or or
Mhm.
just a doubt, and of course you can wear your mask if you want to, but
Yeah.
Guys, I'm gonna get off the meeting because
Okay.
I don't have anything else to say. And
Well,
I want to get
hold
back
on. We
to the
know you
group.
want to get back there, but it is our last meeting, Ruth, so thank you.
Thank
All
you.
yours. And we'll
My
talk some more
pleasure.
about that.
Well done.
Thank
My
you.
pleasure.
Really been something.
Excellent. Excellent
Enjoy the rest
job.
of your evening.
We
Yep.
can all go out to dinner now together.
Yeah.
Yeah. We can. You
Well,
can join the retiree club.
Exactly. I've appreciated all your support over the years. It's been a pleasure and an honor and really, truly enjoyable.
Thank you. You've made it very, you've done,
What a year to go out.
yeah, the best year yet.
No time like the present.
You've been bookended by 2 pandemics. Well done.
True.
Mm.
Good point.
I know.
Very good point.
I know.
All
I
right.
know. All right.
Right.
Have a nice evening.
Thank you.
Bye.
Mhm. Okay, Cindy, I still have you, I know.
Yep.
I don't think that there's anything else,
We need to pick a time to meet, I guess.
a date and a time. I imagine that if it's the 15th, it will be the same as we usually do, the 15th at midnight, like everything else expires.
Well, and it turns out as well, I can't make the meeting on June 16th. I'm leaving town.
Oh, all right, we'll let you go.
So I'm visiting my son in South Carolina.
My sister's there now.
Oh, so we wanted to visit him while he was down there. I can do the
I say
9th.
can you do the do you want to
I
wait
can do the
until the
14th, Monday
14th?
night.
That Monday night, just in case there's anything at the last minute, and
I can
and
do
then
that.
there might be some other guidelines too, because as Ruth was saying, once the emergency order ends on the 15th, there's other things like housing things and everything that are supposed to go for so many days afterwards. So we might have a clearer picture in case there's anything that comes up.
Mhm.
So if you want, I'm free. What about you, Candace? Is that
Candace.
okay for you?
On the 14th,
Mhm.
Yeah,
in person or Zoom?
we'll have to do.
It would be Zoom
it's
because
Zoom,
we can't do
yeah.
in person until after the order, after the 15th.
Yeah.
Um,
Will you be at work?
so it's possible. I'm home alone with the kids.
Oh,
Oh,
So
okay.
it's not gonna be a big deal. I can put them in front of the TV. And if we just have to have like a 15-20 minute kind of check-in, make this happen, I can do it. If it was at like 7 o'clock, that would be fine. If
Okay.
you guys.
Did you
need-
want something earlier? Is that easier for you
No,
or?
honestly, like, they usually go up to bed around 8, so sitting them down in front of the tube at 7 o'clock will be fine. They'll be
Oh,
fine.
they get a treat that night. They get to watch TV. I think we can, and even if we do have as she said, there should be somebody in place by June 1st. We probably will have to have, we may not have a meeting with them in June, or they may do a joint meeting. I don't know
Right.
what they'll do, what the new person will do. That's all coming out. And I would imagine the new person would probably want to meet with us separately, and they'll probably do it in person. So we can see what's happened. The only other thing we do have to do is, am I not correct? Laurel, am I on the right schedule? Do we have to do a new chair? Do we have to switch out
We don't
now?
have to reorganize.
Okay.
I don't believe reorganizing is required. I think in bigger boards, I mean, unless like me a year ago, you were like, oh my God. I mean, Elaine, you have, I mean, let's just take this opportunity to thank you as chair above and beyond on top of vaccine clinics and tracing.
Yeah, you've done
So,
so much.
You
It
have,
was a lot of fun. It was a lot of fun. And sometimes this was a good excuse on the other 3 committees that I'm on when I have to go, I have a board meeting. Oh, I have COVID tracing today. You know?
well, we
It
said
helped
full-time
me.
jobs can be protective, but
Yeah, well, it helped me a lot personally, to be honest with you. I mean, this is my thing. I love public health, and I've met tremendously. I only wish, Laurel, I did home visits with Melrose, and some of the nurses that did the home visits there were people who attended all our clinics, and nothing but such positive
I
things.
know.
And
know.
they were so impressed with everything that we do, and it was
And
so
I
refreshing.
would, Cindy, if you could add this to the minutes, we really need to kind of regroup at the end of the summer and find a way to thank all of those volunteers. I think we've I mean, I just noticed that Frank from Melrose sort of signed off today and said, you know, we're all
did.
done. Thank you so much. And I feel like on the Wakefield side, we kind of, you know, it probably should be a combined effort because they were so many of the same people, and it was such a impressive joint effort between the two. And it might be, I mean, we certainly invite Ruth back to it if it is a thing. You know, Steve Mayo and I always joke that we would do something unmasked on the common when we were finally through all of this thing. But let's just make sure that we're mindful, and we can put it on the agenda for a June or a July. I mean, we usually don't meet in July, but being that we have a new director, I have a feeling that we might need to. Yeah, well done us. We've met faithfully every week, and then every 2 weeks, and then every month, and then, you know, for hours and hours of vaccine clinics. So I think, you know, Elaine, do you feel the need to reorganize?
I don't feel it. I mean, I'm okay. It doesn't bother me right now. I mean, it really doesn't. I have no life now. I have my COVID tracing's down, and things have been better. My husband's feeling better and doing better, so I can
Good.
start to. It doesn't bother me, and I don't. You know, maybe it's time that we just keep it like it is until we have the new person. And
That's
then
what I'm wondering. I'm wondering if maybe we reorganize in the fall.
Yeah, that might be the best when the new person comes in.
Yeah, because, you know, you have been behind the scenes and probably are the best historian as far as the year has gone. So yeah, I would advise it maybe in September. What do you think, Candace?
Yeah, I think that sounds reasonable, more than reasonable. Yeah, as long as you're okay with it. I mean, I know there's only 3 of us, right? So what we're not saying is that this role is coming to me.
Yeah, you're next. You didn't know that?
We
Um,
discussed this
I-
last year.
Yeah, yeah. Well, you gotta pass.
No,
gotta
it's
Got
pass
your
a couple
baptism
months.
by fire.
You've done well. You'll do fine. And you have Laurel and I. And just think, you'll be new. The director will be new. So it'll all be great. It'll all go along great. It will. It really will.
Well,
right,
I
so
think
we
when we
will
can meet in
meet-
person, it would be kind of neat as well.
Oh, much better. Much
I
better.
can't wait
So
to see you.
yeah, we had our very first public health nurse meeting we had it in person, but we had it outside
Mhm.
in person, and it was just, oh my God, was it great. It was so wonderful to see
I
people.
think, so I'm in the psych world now. So we talk
Yeah.
about blunted affect and restricted. I think everyone's been a little bit blunted and restricted, like withheld back. Like I think people
Yeah.
are actually awkward around hugging right now. Like they're
Yeah.
either like bring it in, or they're
Yeah,
we all
you
forgot,
have to act.
what Candace?
we've all forgotten how to do it.
Yeah, no,
Ah, true.
it's funny. I think we have to be really sensitive to people who are still a little preoccupied. I mean, we have people who are kind of checking their environment, and
Yeah.
I think we need to be really gentle.
Mhm.
on that.
But it's so nice though, Laura, you say that, and people will say, and they had a thing on the TV the other night of how to approach people, to ask them, is it okay
Yep.
if I hug you? Are you open to a hug? Are you
Oh,
open
good.
to this?
Yeah,
I think that that's the most amazing thing. I think people just have gotten more aware. You're on the mental health side. Hopefully you'll be able to guide us through any big
Mm.
problems. But just the fact that I think people are getting a little bit more aware of other people and their feelings and what
Yeah.
to do.
I hope
So,
so.
I hope I think that's one of the positive things that will come out of this. I really do.
It was concerning to me that prior to these decisions about mask orders ending, and I knew it was shortly thereafter, that the local politics got conflated with the masking issue, and it was really I was having a tough time with it.
Mhm.
So hopefully that's behind us. Like, okay, clean slate, move forward.
I think the best thing too is that if you notice and listen, and I've been listening on a lot of public health things and talking to people, everybody in public health seems to be on the same page. So it seems like everybody's just gonna go with the flow, and yeah, it's time, let's all do it. So
Yeah.
I think we'll have an easier transition, not like we did at the beginning, this town or this city, you couldn't
Right,
wear a mask, you had a mask, but I think everyone's kind of on that
that
same
doesn't
page.
sound like any towns are holding on.
Apparently,
Brookline was,
no,
but
yeah, I guess everyone's really gonna turn according to what I've heard. People have said like different things, like some, no, they're not gonna make anything really mandatory. You can't make mandatory, but you can make mandatory.
I mean,
I
it's
don't know.
really interesting because I'm doing a residential camp, and I've told the really we're still being
Yeah.
quite strict, but we're going to look like outliers, and
Mm,
people are still quite worried. And I said, I don't
yeah,
know, I mean, if the numbers are truly what they are, I mean, we're down to 2, we were 0, right?
yeah, we're zeroing up. Ruth
For-
sent that report too
For
for like
several
4 or
times,
5.
and then I think we just
Yeah,
had 2. I
yeah.
hope those are outliers and that they're okay. But
Yeah.
it is a little
Scary.
too good to believe. I'm a little.
It is, it's not like we've been through, like with flu season, we always say flu season starts in August. We go from August to April. We have a time limit.
Yeah.
And we did, even with H1N1, we treated it as a flu, and we just knew it would kind of dissipate. But with this, there was nothing, no ending in sight, and we didn't
Right.
know. But
Right.
let's hope we are on the worldwide
It's
is what I'm looking
worldwide.
for.
Looks like
That's what
vaccines
we want.
work.
It
Okay,
is.
so the
Okay.
14th at 7 p.m.
Yep. Cindy, do we have to just notify, is there someone we'll notify, or you'll be able to notify to set up a Zoom for us?
Yeah, like normal. Yep, same thing.
Okay.
Okay.
We'll set up the Zoom for, instead of our regular Wednesday, we'll do it on the Monday.
Is that okay with you too, the Monday? Is that
Sure.
all right? It
Yeah.
should be a short one. We'll just put on the
Yeah.
agenda, I think, that night, just
Yeah.
We just have to pull that emergency order
Yeah,
and take a look at it.
yeah.
Yeah.
I'll,
Can you
I'll,
send-
I'll look at it tomorrow.
Okay.
and
then
see what it
I kind
says.
of think the first board meeting we have with a new director, to literally review every grant that we've got. I think
Mm.
we're missing. I just kind of lost track. It would be nice to have a spreadsheet with name of grant, the money in the grant,
Mhm.
the duration of the grant, the funding source, because sometimes I've lost track because we've done such an incredible job at getting it. And by we, I mean the director,
Yeah, Ruth has. That's
you know.
one of the things with people for this job.
I know.
Amazed at what the work is. All right, we can have a motion to adjourn.
I can make that motion. Motion to adjourn the meeting.
I second that.
Second that, all in favor?
Corville, aye.
Finnegan, aye.
Corbo, aye. Silver, aye. So motioned, we will close the meeting. It is now 7:36 PM. And I thank you all.
And again, Madam Chair, we thank you.
Definitely.
Wow.
Most definitely.
I feel like I haven't done anything. I don't
Oh,
know.
stop it. Oh, Elaine.
Well, the only thing is, I'm going to tell you, I know somebody who was going to a Pfizer clinic, and I said to them, "Are you watching what they're doing? And were they diluting it right? How long was it to take them to dilute it? You better watch what they're doing." And they said to me, "Oh, I watched them closely, but they had already diluted it." What do you mean they had already diluted it? What time?
I was preparing Vivitrol, and that stuff has to be manhandled. Like you
Oh.
have to like pound it to get it to reconstitute. And I said, "Oh, this is very different." Opposite.
Well,
So think of what we learned.
we did. We learned a lot. We did a lot. We learned a lot. And I think the best thing that came out of everything for me was the fact that so many more people were exposed to public health.
Yep.
And it was a great
In a
thing.
good way. Yeah.
Oh, in a real good
Yeah,
way.
people
Real
were
good way.
very- Yeah.
So that
And-
was the most positive, I
And
think.
an
of the whole thing.
incredible crew of volunteers. So
Yeah.
we need not to forget that. And we need,
Yeah.
maybe we can talk to our volunteer coordinator and just make sure that we haven't lost that resource and
Yeah.
that they know that we're thinking of them. I think Christmas holiday cards are in
Yeah.
order.
Maybe with the picture, I don't know. We'll
Yeah, I
see.
know. 3 board members in a hat. Yeah.
Yeah, or
exactly.
a couple of little vials. Maybe that would look good.
All right, you
All
guys
right,
have a
thank
wonderful
you,
evening. Take
everyone.
good
You
care.
too. Thank you. Thank
Good
you,
night.
Cindy.
You're
Thank you.
welcome.
We'll see you guys next Thursday.